Dr. Behn Banihashemi in the house. Y'all, we got Dr. Behn. I've been waiting for this podcast for so long because you guys have asked for Dr. Behn, and now you are receiving Dr. Behn. We are going to be talking about all things longevity. His resume is insane, as you heard about in the intro, but he is a trendsetter. He's an innovator. He's an entrepreneur. He's a bit, I must say, I'm a bit jealous of all the things you're accomplishing, my friend. But welcome to the show.
Thanks, Scott. Thanks for having me, man. It's a pleasure. It's a long-awaited conversation for me as well. Been looking forward to chatting with you. It's always a pleasure.
Oh, thank you, brother. I want to just get right to it. You started the cardiac longevity clinic just recently. I'm wondering what was the driver?
Yeah, thanks for asking that. I think it comes from a couple of different routes. So number one, as you know, I run a cardiology clinic in the west end of Ottawa and have now been a cardiologist for over 10 years. And one of the frustrations that I know you share to some extent as well is just a frustration with the way we deliver healthcare in our country. We are very much focused on band-aid solutions and kind of dealing just with complications of disease rather than addressing the fundamental underlying issue of why these conditions, these metabolic diseases happen in the first place. So as a cardiologist, for over 10 years, I've kind of dealt with these patients, these clients coming in with cardiac disease, major complication, major cost to healthcare, major cost for them personally and financially. And all we do in cardiology is managing the kind of the end stage of the disease, managing the complications of the disease, which is a very inefficient, unintuitive way of managing conditions. They come in with a heart attack rather than focusing our attention as to why they had the heart attack in the first place. We put them on pharmaceuticals, we put stents in their hearts, we replace their valves. We do all these very expensive, very complicated procedures that, expose these patients to a ton of different side effects if it's a pharmaceutical or complication, if it's a surgery and procedure. But then they come back again to me a year or two later because we're not addressing the fundamental issues, which is, their lifestyle, the risk factors that they're exposed to, the lifestyle choices that they're making, the metabolic disease that is underlying their problem. We never address that. Unfortunately, there's no focus. There's no money or funding or spending in that part of healthcare. And frankly, even in our education, as you know, we get such a limited exposure to the actual science. Now, there's tons of science for all of these primary prevention strategies, these lifestyle strategies that would have a massive impact in reducing cardiovascular complications and improving people's longevity. But we don't learn it in school. I spend 1 month in my entire training. I have 12 plus years of medical training, spend only a month in cardiac rehabilitation. And what I learned in that rotation was so limited compared to the available science. So all of our effort, even in our medical education, and definitely when it comes to healthcare spending and our time in the clinic, goes towards managing complications rather than addressing the underlying problems, the fundamentals of why people develop these diseases, the cardiovascular disease, heart attack and stroke and heart failure in the first place. So that frustration is what led me to really start this clinic. And of course, I'm also personally very passionate about it. This is, wellness and health is something that I am myself a practitioner of, super passionate about, have been doing it for a long time. So really the idea was kind of to bring these two things together and kind of create a practice that is personally meaningful to me, personally enjoyable and rewarding to me, and I think would make a massive impact in my patient population as well.
Man, you don't hear many of us talk this way, Ben. Many of us talk about you're right. Like there is a significant amount of data out there about primary prevention that we just don't highlight enough or get educated on during medical school, during residency, during fellowship. So I do feel like your instincts of trying to push this is going to have a significant impact. And I think what I love about it too, Ben, is that people will follow. the kids will follow. The young trainees, they'll be attracted to this because, in my opinion, it's going to make a significant difference in people's lives, which is what we want to see.
100%.
So, absolutely. So, how does this look? Like when I see that, Dr. Ben's got this new clinic. Do I just go to a website, sign up? Like what can I expect walking through the door?
So it's very much a kind of an a la carte menu that we offer clients with regards to what they want to have, because everybody, I think, again, one of the downsides of our healthcare system, which I'm sure you've experienced, is that we are very cookie cutter. We don't have any customized plans for people. What is good for me, what works for me, what I need to be able to get healthy is different than what you need. So this whole idea that anybody that comes through the door, we offer them exact same treatment, it is so counterintuitive, but that's how we do 99% of medicine. I give the same drug to 100 people. I give the same exact prescription, same exact lifestyle plan to 100 different people. But obviously that's not going to work. Obviously the compliance is going to be low when you're offering exact same thing to every person. So ours is very much personalized and customized plan. So when you come in through the door, we do a very comprehensive assessment on you to determine in the first place what you need. What are your needs? What is lacking based on your clinical profile? And then we offer you basically a menu of things that you can do. But in general, it's divided into kind of 3 different categories of services that we offer in the cardiac longevity clinic. So number 1 is cardiovascular assessment, which is obviously my wheelhouse. So we can do obviously a full cardiovascular diagnostics on the clients, from getting their VO2 max and do a ischemic restratification to look for coronary artery disease, so looking for blockage in the arteries, to getting an ultrasound of the heart, echocardiogram, to do a comprehensive structural assessment of the heart, to doing carotid ultrasounds to kind of get a sense of their overall vascular risk factors and the risk of stroke, to peripheral ultrasounds, looking for peripheral vascular disease. So that's kind of the first component of the program. The second component is really a comprehensive metabolic assessment. So we do kind of a full blood work panel, kind of above and beyond what somebody would get in their family doctor's office, focusing more on markers of both metabolic disease as well as inflammation, as well as insulin resistance, nutrient deficiencies. So there's a blood work panel, and then we combine that data with a DEXA scan, which would give us a pretty good idea of, body composition, basically the gold standard for assessing body composition, looking at visceral fat and looking at their muscle mass. And then we combine that data to give them a pretty comprehensive picture of their metabolic health. That's kind of the second component of the program. And then the third component is really the lifestyle assessment and optimization. So I work with multiple athletic therapists, strength coaches, as well as dietitian, sleep specialists, as well as psychologists. So we kind of basically go through those 4 areas of lifestyle. So we do a full fitness assessment, full nutrition assessment, a home sleep study to kind of get all their sleep architecture data, as well as assessing for sleep apnea. And then we do a kind of a mental health / stress assessment. And then based on how you score in these 4 areas, then we actually give the clients an actionable plan as to how to optimize these 4 areas of their lifestyle to get more metabolically healthy and improve their longevity.
Brilliant. So Ben, I mean, the thing that I fully enjoy you mentioning is the idea that it's customized, it's personalized, because I think we're not doing this enough in medicine at all, frankly, and it's the future with the amount of data that's available to us. But I think that approach, like, not that you need validation, but if I were to personally have a longevity clinic set up, this is exactly what I would want. You have some like diagnostic tests, blood and structural, to be able to get an assessment of body comp, like all these things that you can't get anywhere else, really. It's so valuable that you could get this in one center. So because of all this, I would imagine people have to see you front and center. There's not a virtual option. Is that correct?
Not yet, but I'm kind of in the process of starting that as well, to kind of offer this kind of more widely in a virtual manner.
Yeah. And and di- and when did we start the longevity clinic?
So it's been about 8 months now.
8 months.
Yeah.
It might be a little early to throw this at you, but like, can you think of some transformations that you've seen, or has there been any stories that come to mind where the impact that the cardiac longevity clinic has had on a patient has been significant in your mind?
Yeah. So actually, my very first client was one of my good friends and neighbors. And he essentially he came kind of through our clinic, and he now wants to be a kind of a business development person for my cardiac longevity clinic because he saw such a massive impact. So basically, I kind of briefly going through his history. Basically, a client, a neighbor, very nice guy, but not really necessarily taking care of himself very well, overweight, had metabolic syndrome, significantly elevated blood pressure, as well as prediabetes, never really diagnosed. Most importantly, because he was overweight, he also had severe sleep apnea. So coming through our clinic, first thing that happened, obviously, we diagnosed him with severe sleep apnea, put a CPAP on him. That itself completely changed his life, right? Because I mean, this guy was having almost 90 events an hour. So just kind of putting the
Wow.
CPAP on him, all of a sudden, he's a business owner. All of a sudden, his energy goes 10x. So just that completely transformed his life of being able to function at a whole different new level. And his blood pressure dropped. He had this huge issue. His family doctor was pushing him to start him on blood pressure pills. Just getting his sleep apnea treated, his blood pressure completely normalized even before we kind of do any other intervention. And then we gave him a fitness plan. Through the fitness plan and through his cardiovascular diagnostics, we actually found out that he had bicuspid aortic valve, which is, for your audience, is basically this condition where your valve has a birth defect. The main valve out of your heart has a birth defect, where instead of three kind of little valves, it has two. And because of that, it degenerates faster. But this guy was in his early 40s, so the valve should still be fairly intact if you're healthy. But aortic valve is very much affected by metabolic disease. So when you have high blood pressure, prediabetes, all these factors that cause atherosclerosis, they can also cause deterioration of the aortic valve. So his aortic valve was already chewed up quite a bit for someone in their early 40s. It was already had moderate aortic regurgitation, so the valve was moderately leaky, all primarily driven by obviously genetics, but also the fact that he had metabolic disease. So discovering that was also huge for him. His aorta had already dilated a bit because of his hypertension. So just imagine what would have happened to this guy if he hadn't walked through our clinic and he would have come 5 years later to discover all of these things, right? His valve would have probably completely been chewed up. He would have needed an aortic valve replacement at the age of 45, which is a pretty catastrophic complication for something that can be managed all the way to your late 60s, probably without having any surgery. So I'm hoping that now that he went through the clinic and then through all of that, obviously he kind of had this wake up call. So we put him on a fitness program, on a diet program. He's already lost about 30 pounds. His blood pressure is now normal. His metabolic markers are all normalizing. So he actually is a part of, because we offer a kind of a longitudinal program as a part of our longevity program too. So he is now a kind of a part of our program. So we are seeing him on a monthly basis through our nurse practitioner program, and I'm seeing him every 3 months. So he's made these massive changes in his lifestyle, which is probably going to be for him life-saving. And then through all of this, he also had all of his daughters screened for bicuspid aortic valve, and actually one of his daughters now had bicuspid aortic valve, which would have never been discovered again till God knows when. So the amount of impact that you can create coming through a clinic like this, particularly for this client of mine, it's just I mean, he kind of talks about it all the time of how absolutely life-changing for him, right? To have all of these things done, how he feels now, and also kind of moving forward for his future, how we have impacted him and his family.
Incredible. I love hearing these stories for several reasons. One, he has a new lease on life. He's feeling better. He is actually more functional, going to be a better dad, going to be a better business person, all the things that you want. Second, big highlight lesson here too, Ben, is that a lot of people, they feel like these diagnoses that they have, these chronic disease diagnoses, are permanent. Where you just illustrated in this case, how he was able to reverse his hypertension, reverse his risk of metabolic syndrome because of the changes he made, lifestyle modifications that he's made. Like that's not a pill that he's going to take forever. Like that's huge. And then third, I think what you see when you have a patient like that in their circle, like you made the example with the daughters, but I can guarantee you in his network, there's going to be people that see what he went through and they're going to be motivated. He's going to be an ambassador of health. This is the intangible that people don't realize too about some of the stuff that we talk about prevention. It's contagious. When you got that mom that came off her diabetic meds because of her whatever lifestyle modifications that she took, there are going to be people that follow. I promise you. So it's scalable and it's sexy too when you see people getting healthier, literally and figuratively. Like so, I love that story, Ben, because that just exemplifies what the power is when we can focus on prevention.
100%.
Absolutely. So I'm curious from your perspective where you think some of the levers that are most impactful for patients. So I want to focus on nutrition. First of all, you get a lot of information out there in terms of what approach makes most sense for people. And I know, once again, this is a personalized approach for many of our patients. But in your experience, in the stuff that you've read or listened to on podcasts, what do you think is some of the, at a high level, the things people could do that can move the needle when it comes to their nutrition and their metabolic health?
Yeah, I'm actually really curious to hear your thoughts about this too, because obviously you have a lot of expertise in this and you've talked to a lot of experts on this. But I think nutrition is probably one of the most challenging ones, right? Because there's so much out there, right? There's so many fad diets out there. There's so much information that's constantly thrown at people. So I think nutrition is tough for that. And then the other reason that, as you probably know, nutrition is tough is because there are really very few randomized controlled trials looking at nutrition interventions, right? So I think those are some of the things that makes nutrition science very, very difficult to look at. It's a very difficult thing to do randomized trials in because it's very difficult to isolate one particular ingredient within your diet, one particular component within your diet, and kind of do a randomized trials on it. And of course, in medicine, that's kind of the best type of evidence we like. But I think it's important to look at some of the other evidence when you have prospective data, at least. It could be, very helpful to look at. So I would say out of the things that I've seen anecdotally, talking to experts and kind of looking at the literature myself, I would say probably the number one thing that would make the most massive impact for people is to look at their diet somewhat in terms of their macros, right? Like you need to be somewhat aware of what is you putting in your mouth with regards to what is kind of the composition, right? So how much protein am I taking in, how much carbohydrates I'm taking in, how much fat I'm taking in. Most importantly, focused on how much protein you're taking, right? So protein is probably massive out of all of your macros. Your carb and fat might be important if you're looking at a massive amount of weight loss, but number one, probably protein is huge. I know you are a huge advocate of this. You have your own brand of now kind of protein powder kind of because of that, because most people do not take enough amount of protein. And it's actually very, very difficult. And when you look at the data for muscle mass, which is a huge determinant of your longevity, there's tons of good data associating muscle mass with all sort of longevity metrics. One of the most important things other than strength training would be how much protein a day you're taking. And as you get older, it becomes more and more difficult to have adequate amount of daily protein intake to maintain that muscle mass. So making sure that you're somewhere between, 0.8 to 1 gram per pound of protein a day, which is extremely difficult, but at least trying to get close to that is probably one of the main challenges that most of my clients, almost every client that comes through, even the ones that are super healthy, very aware of what they're eating and their longevity lifestyle, they're probably lacking in how much protein they're taking. That we see that almost universal in everyone that comes through our clinic. I think the other one about nutrition that universally applies is how much alcohol you're taking in. Again, it's a very black and white idea. Any alcohol is too much, pretty much. Now, I don't tell people necessarily to stop drinking altogether, because I also appreciate that there's a balance between longevity and pleasure. But I emphasize, and then we can kind of delve into that, of all the available scientific data as to how alcohol would impact your health via different ways, via your sleep, via how much calories you're taking in, increasing your risk of all sort of cancer, particularly GI tract type of cancers. So I think that's, again, a very black and white universal idea that I can always, advocate to people to kind of cut back on. And I think the other one that is super, super important, again, universally, is making sure you're taking enough fiber. Fiber has massive, massive data that I'm sure you're aware of. There's a lot of good cancer data when we look at, the risk of developing things like colon cancer, improving your gut microbiome, has tons of good data of how fiber has a massive, massive impact on that. And just making your food also less calorie dense, which ultimately leads to reducing your calorie intake, balancing your calories better, that would ultimately lead to, better weight strategy, especially for people who have metabolic syndrome. So I think those are probably the three top things that I almost talk to every client about, that is almost universal, that people are not necessarily, abiding to very well, and can make a huge, huge impact.
That list is tight. It really is. The other levers that I add, and in terms of that I think could have a significant impact in metabolic health, is elimination. So like the processed food side, like if you stick with whole foods in general, you'll get at least your fiber side. Usually you're more likely to hit your fiber goals. The macros are going to be enhanced. So for me, that one is a lever. And then the other one I would add, not with confidence, but with as an option, is like a time restricted eating. It's not for everybody, but certainly as a lever for folks that want to put some version of a restriction to their diet. I find that could be helpful for some.
Yeah, 100%.
And
I
what
mean,
about,
those are very, very good points. Really, ultra processed food is massive.
yeah, like and like when we look at our North American diet, it's funny. We were in Europe and Ghana last summer, and you do realize that there's a significant amount of processed food that we have routinely in our household too. Like we with three kids, like
Well, you
it's
can't escape it,
unfortunate.
right? Like nowadays, it's so
Yeah,
difficult.
yeah. But yeah, that for sure to me is another lever. What about? I'm curious in terms of exercise, because I know you're a beast. Like I've seen you
Not like
with
you,
in
man.
terms of.
I try, but I'm trying to, keep up with you.
Oh my goodness. I feel like you're like in terms of the cardiovascular side, you really seem to be at the next level. So I'm curious, one, either at a personal level what you try and do, but also some of the levers that you like to promote for your patients.
Yeah, so it's interesting that you bring that up. So for me personally, and I think actually for a lot of my clients, coming up with a comprehensive fitness program is probably the most challenging lever to try and optimize. Because nutrition, once you know the principles, is relatively easy. You know what you're doing. It's relatively easy to get to where you want to be. But with fitness, is so difficult because everything you do affects another lever. But generally speaking, when I talk to my clients about it, there are really 5 areas that you need to have some sort of an exposure to on a weekly basis. So, kind of a lever one is your aerobic capacity. So, when you look at longevity data for fitness, probably the number one with the most widely available and most frequently available research and studies on longevity is really this concept of VO2 max, right? So, your maximum aerobic capacity, how many milliliters of oxygen per kilogram your body is able to consume per minute. So by far, it has the most available evidence, strongest evidence for longevity. So I think if people want to start somewhere, I would say the number one place to start is really to look at their VO2 max and the ways to optimize it. Where are they at compared to their age and gender? What percentile are they at? And how much they're able to improve that. Now, the important thing about VO2 max is not only it affects your life expectancy, it really affects also what we call health span, right? how much functionality you have as you get older, right? Because your VO2 max drops by about 10% per decade. So if you don't start at a very high level, if you don't optimize it when you're younger, as you get older, that's how you run into, shortness of breath when you're doing your activities of daily living that you and I commonly see. VO2 max is a huge determinant of your risk of being able to get discharged post hospitalization, how you recover from surgeries and procedures. There's tons of data available across all different medical disciplines of how important your VO2 max is to your overall prosperity and longevity as you get older, especially. So I think you got to do something every week to try and work on that. And as you know, it kind of basically goes into two categories. You do some sort of an interval training. We can kind of go into more into depth in that. And then we can kind of zone 2 training, which is really the fundamental of how you optimize your aerobic capacity and your VO2 max. So I think those two are probably should be the first things that people kind of institute into the daily lives of their fitness is really that. Then you kind of go into the strength training is the next pillar, which is extremely important. We talked quickly about muscle mass, but there's also a lot of evidence also for strength itself. Things like grip strength being a very important metric in longevity. Is this very interesting data I can share with you of how grip strength is associated with your dementia risk. Things that you would normally not associate with each other at all, but there is actually pretty good data. And it all goes back to you cannot have grip strength without strength training. So people who have good grip strength are always physically active, always engage in some form of exercise to be able to maintain that grip strength. And then through that, they're able to improve all these metabolic metrics that would ultimately lead them to having lower risk of things like dementia, which, as you know, is metabolically driven to a huge extent. So definitely strength training, another component. And the two last components that I always tell patients about that most people actually ignore once you want to get from the 90th percentile to 100th percentile of fitness is really mobility and stability. So I think those are two huge metrics that a lot of us, especially younger people, ignore. But as you get older and older, it becomes extremely more important. Both of those metrics are very important, not so much for your longevity per se directly, but more for preventing injuries. So once you're more stable and once you're more mobile in your joints, and if you have a good comprehensive program that you can do on a weekly basis, it really reduces your risk of injury. It reduces your risk of fall as you get older. Of course, the strength is a part of it, but strength without stability will not prevent falls and will not help you to prevent injuries. So really kind of those two are, I would say, the ones that most people kind of often ignore, but are very important to do it at least once a week to have some sort of a mobility and stability routine.
I love it. I love it. It's like Peter Attia says, like you want to be able to be 80 and put your suitcase above, like in the airport, to be able to put it on.
Yeah, that's right. Or just pick up your grandchild from the floor, right? Like,
yeah, absolutely. And I could guarantee almost all of us can use more mobility and stability. And but yeah, to reinforce the grip strength too, because I think a lot of people sometimes they take things literally. My personal opinion from that is, as Dr. Ben mentioned, is that it's directly strength. So I don't think if you just work on your grip strength, you're going to live longer. But mind you, there's some good data out there to show that if you improve your grip strength, you will get stronger in your lifts. So if you are looking to improve your whatever lift you're trying to improve on, that's something to enhance. But yeah, this is there's some gold here in terms of gold nuggets here, Ben. What about, you hear a lot about blood work, differing blood work. Like for example, if you go on X, you'll see different opinions on LDL in terms of its impact on longevity, different biomarkers. You mentioned the calcium score. Like what in terms of diagnostics, in your opinion, are real significant in terms of getting an assessment on longevity?
yeah, so I think at a very basic level, anybody over the age of 40 should have a full panel of looking at their lipid profile, looking at their LPA, looking at some markers of insulin resistance, at the very least looking at their hemoglobin A1C, but ideally looking at, their insulin levels. Looking at some sort of an inflammatory marker, I think, is very important. So, we use kind of hsCRP. There's many different ones that you can kind of use. I also look at uric acid, because uric acid, as you probably know, has a indirect relationship with your metabolic health. So one of the reasons that you develop high blood pressure in the context of metabolic syndrome is usually because people have higher uric acid, because it's a byproduct of breakdown of lipids in your body. So it usually has an association with your triglycerides. It's a part of that pathway. So kind of looking at those kind of markers, so uric acid, and then uric acid itself is a marker of inflammation. Obviously, it can lead to gout. And you see this all the time, this correlation between, obese people developing gout. A lot of it is related to that pathway. But yeah, so some markers of your clear lipid profile, markers of insulin resistance, markers of inflammation, and your LPA, because it's such a common undiagnosed condition for cardiovascular disease. So we have a particular interest and a lot of focus on LPA, because through our clinic, even, the patients that have already come through my clinic, we have seen multiple people that we've caught with significantly elevated LPA that they thought are quite healthy. They look healthy, but because of this genetic predisposition to having what I like to call sticky cholesterol particles, they have significant atherosclerosis. And then we do a calcium score on them, and their calcium score is through the roof, despite the fact that everything else looks fine if their family doctor would have looked at them. So those are kind of some of the basic things that I think everybody over the age of 40 should get done, no question. And then you get through some of the weeds of what else matters, looking at the liver enzymes for fatty liver disease. Again, NAFLD, a indirect marker of a lot of bad things, including your metabolic health. Those are kind of some of the secondary things we look at. Calcium score is interesting. So I'm hoping that at some point we'll get to a place where we have very easy access to private CTs, because right now it's not really readily available. It's very difficult to get a cardiac CT to kind of assess for calcium score. So in my clients, I really reserve it for people who've had a positive treadmill stress test, and they are in the kind of a low to intermediate risk of cardiovascular disease as to whatever kind of risk score that you use to assess the risk. Kind of in the low to intermediate risk with a positive treadmill stress test. Those are typically the people that we send for calcium scoring. But I think it's a very, very, in a private healthcare environment, is a very, very useful tool for anybody over the age of 40, really, to kind of get a direct look at their vascular risk and the risk of heart attack. And there's tons of good data for it.
Yeah, absolutely. I want to end with, this might be a bit of a challenging one, Ben, but I respect your opinion with a lot of this stuff. What do you think we got to do from advocacy, from a what do we got to do to get the word out? How do we get more buy-in in terms of the preventative health side? Like, what I appreciate about Ben, like, he literally walks the walk in all aspects of life, guys. Like, he lives a healthy lifestyle. We occasionally get on chat, like text each other about some of these approaches that in terms of healthy living. But he's living it, and then he's also being part of the solution, which is opening up this clinic, right? Which is available to our local Ottawa folk. But what do you think we got to do to amplify this, to scale this? Because it's, as many of my audience has heard, I get sick of seeing patients and seeing them suffer, seeing their families suffer because of preventable disease. And if we had more oomph, we had more resources, more strategy, being more strategic about it, I honestly think we could put a dent in this. I have no doubt about it. But it's a long-winded question. But what are your thoughts around that?
Yeah, so I think, things like what you're doing is super valuable, right? Like having this podcast, having this platform, with all of your followers on social media to be able to spread this message is very, very important. And the important thing about, us, you and I, is public trusts us, right? So going through our education, I think we have the credibility to kind of talk to people, and hopefully a lot of people would listen, because I think for a lot of people, particularly on kind of a digital space and social media, is really the credibility, right? Because there's so many people, there's so much information out there, and as you know, a lot of it not necessarily the most accurate. So I think credibility is a certain piece. So I think we are definitely in a privileged place to try and kind of use our time and use that credibility to kind of give people credible information that is available and backed by science, and kind of spread that message. But I do think that kind of a digital space is by far the biggest. What you do, getting on, TV, getting on radio, I think that has a huge, huge impact, right? And a lot of it is repetition, right? Like once people see it once, maybe they don't believe it. They see it a second time from a second Canadian doctor, they will kind of believe it more. So I think that is a huge part of it. I think the other thing that is super important is how we communicate the message. Doctors sometimes tend to be a little bit too scientific. They don't talk the common language that is easily understandable for most people. So I think breaking it down and simplifying into easy, actionable steps is very important. I mean, I can talk all day about, the metabolic pathways of metabolic disease and how the physiological and biochemical pathways look like. That means nothing to anybody, right? To most people. Really what matters is, break it down, actionable, simple steps that people can follow to make a difference. I don't know if you saw me. I posted a video about, a 30-minute walk, because I came across this study.
Oh yeah, it was
that,
good. It was tight.
Yeah. Like something simple that anybody can connect to, that has available evidence, is actionable for someone to start somewhere. Because a lot of people, that's the other challenge, is if you're very sedentary and overweight and have all these problems, it's very difficult for you to start. That first step is so difficult. If somebody's already fit, making a little optimization is very easy for them. And sometimes I'm afraid that maybe a lot of our audience are those people that are already super fit. So the question is, how do you connect to the masses who are not necessarily anywhere yet? They haven't started even going to the gym, or they have no idea about nutrition. How can you make it as simple as possible, as actionable as possible, for them to make a small little step today that over time would have this massive impact? So I think those are kind of some of the things we can do. And, I try to do in my communication is to really make it simple and actionable for as many people as possible.
You do it well. And one thing I don't know if it's important or not, Ben, but I think I feel both of us do this okay, is just being honest in terms of our certainty. It irks me when you on the social media feeds when people are like, "This is the only approach. This is the best approach. This is tons of evidence for this," when they're talking out of their backside. I think being humble and saying, "This is what I think. This is my suggestion. This is based on the evidence that I see in front of me, or the level of evidence we had. This is my suggestion, or this is how I approach it." I think that's I think it's more important than we think, because what it comes down to is, you mentioned it before, it's trust. And we got a certain level of trust because of our credentials, but there's still the execution. Like when you see, like, I think this is where the pandemic screwed some of us up. Frankly, we were talking like with absolute certainty about certain things when we weren't 100% certain. We thought it was the best action, but when you come across that way, I think you could lose the public. So yeah, I just want to commend you too, Ben. Like even when talking today, based on the evidence here, this is what the standard when we're lacking some systematic reviews or randomized controlled trials here. Like I think that goes a long way. Even though I haven't heard this from people, this is just something that intuitively I feel.
No, you're correct about that. That's a very, very good point. Yeah, like one of my main red flags that goes off if I see somebody on social media is if they're talking with too much certainty. Then you know that's probably not right because we know even in things that we think are certain, like there are a lot of things in medicine that we thought for a long time that this is a certainty, and you have randomized trials even, and even those a lot of them end up becoming debunked, 10 years later. So forget about that. Even things that you don't have randomized trials for, So yeah, I think that's very important to always remember that everything you hear, you got to take it with a grain of salt and understand that nothing is 100% certain when it comes to lifestyle medicine and wellness space.
100%. Yeah. Ben, this has been wicked. It's been a long time coming. I'm actually kind of sad we didn't get to do this before because I think a lot of people are going to benefit from this. And we're releasing this obviously during what's it called? Heart Healthy Month?
Heart health month.
Heart Health Month. So, but Ben, how do people track you down? Where can they find you? Where do they learn more about the clinic? Where do they sign up, baby?
Thanks, man. Yeah, so our website is cardiaclongevityclinic.com. So all the information about the clinic and our services are on there, or they can send us an email at contact@cardiaclongevityclinic.com. Our phone number is in there. There's a form they can fill out or directly send us an email. So any of those would work.
Amazing. Ben, thank you for doing all that you do.
Thanks,
We
man.
definitely got to keep this momentum, brother. In fact, we need to collaborate more now that I think about it. But stay tuned for some more action, my friend. Thanks for doing this.
Thanks, Kwaju, and thank you for all the kind of the awareness. You've always been my role model in this kind of a digital space and how to spread awareness for health and wellness. So thanks for doing everything that you're doing.
Man, that's kind of you to say, but thank you. And thanks for doing this.